and welcome back to the Home Care USA Updates podcast. My name is Bliss and I'm so excited to go to volume 3 of our educational series today. So let's get into what we're going to talk about. Have you ever heard someone say, "My child receives services through a waiver"? "We've been placed on a waiver waitlist," or "Our state is changing our waiver programs," or maybe you've seen terms like 1915B, 1915C, or 1115. That may all sound familiar, or it may sound like something you've never heard of, or you've heard of it and just don't know exactly what it is. Well, that's what we're going to talk about today. We're going to go into what is a Medicaid waiver, why states use waivers, the difference among the major types of waivers, the populations they serve, why there are waiting lists for waivers, how many families can figure out which problem may be right for them, common myths about waivers, and recent federal headlines surrounding the 1115. That all sounds like a ton of information, so I want you guys to take this podcast step by step. We're going to start just on the baseline of what a waiver is, and then we'll dive a little bit deeper so that you have the full knowledge on everything you need to know. So starting out, I just want to clarify what the word waiver means. The word waiver does not refer to one singular Medicaid program. It is a general term for legal permission that allows a state to operate parts of its Medicaid program differently from the standard federal rules. Different waivers do different things. Some change how Medicaid care is managed. Some help people receive services in their homes rather than institutions. Others allow states to test new ideas that they may come up with to help support their specific population. So just like, the general definition of a word waiver, it's all about how states can help manage their Medicaid program. Then they may need extra things that the federal government doesn't have in their rule book. These waivers are allowing them that opportunity to kind of curate their Medicaid program to fit their population specifically. And in previous episodes, I spent a lot of time on Medicaid versus Medicare. Today, we're talking about Medicaid specifically. Medicaid is a joint federal and state health insurance program for millions of low-income adults. So we went into that. I don't want to jump all back into what Medicaid and Medicare is, but now we're just going to be talking about Medicaid waivers. So keep that in mind. So what is a Medicaid waiver? In everyday language, when something is waived, it usually means a normal rule or requirement has been set aside. This is generally what the word means in Medicaid. Federal law establishes rules that state Medicaid programs usually have to follow. However, federal law also gives CMS permission to approve certain extensions for certain circumstances. So that's what these waivers are those certain circumstances where things that don't match the federal laws need to be waived to kind of help states create a personalized program under Medicaid and create it to fit their population better. Because I think we can all agree every state is different. Every state has different needs, different populations, different demographics. These waivers are allowing states to kind of cultivate this program in their own state to better support the population. So I hope that makes it make sense a little bit easier. So I want you to think of Medicaid as a rule book. Every state has to follow that rule book or that playbook, but a state may ask CMS, can we operate this part of Medicaid program differently? So it's not changing the whole thing. It's not throwing the rule book out the window. It's changing specific pieces of the program to better fit. So typically after they ask that, if it's approved for generally a 5-year time span, the state receives authority to operate the program according to the terms of that waiver. So it's almost like a negotiation. They kind of negotiate back and forth on how this would work, what it would look like, and if implemented, they have 5 years to kind of make it work in their state, and then it'll kind of come back up for review after that. So like I said, a waiver does not replace Medicaid. It does not throw that rule book out. It works within Medicaid. It may change who can receive services, where a service can be provided, how care is organized, which provider someone may use, or how the state pays for and delivers the care. So those are just kind of things that can be flexible within Medicaid. So now moving on to segment 2 of this podcast, why do states use waivers? So this is going to get a little down nitty-gritty of why they are even implemented and why they exist. States use waivers because every state has different needs, as we talked about before. Populations are different. Rapid growth in population is a big thing right now. It's just so many different things. Some significant shortages, such as for nursing shortages, personal care aides, direct support professionals, all of that can play a major role into this. A waiver allows a state to design a program that responds to its own population, provider system, budget, and priorities. So that all goes into play here. For example, a state may want to require people to receive Medicaid services under managed care environment, provide specialized services to people with intellectual and developmental disabilities. That's something that is actually happening in my own state. Help older adults remain in their homes, support children with complex medical needs, test a new behavioral health program, or try a different way of paying healthcare providers. That's all things that can happen when a state's looking at, well, do we want to do this? Do we want to go to CMS about a waiver? So that's kind of, if you're thinking about what kind of conversations Medicaid may be having, that's a great way to think about it. Without waivers and other forms of federal flexibility, state Medicaid programs would have fewer options and not be able to respond to local needs. Think about if every single state in our entire country, all 50 of them, even Alaska and Hawaii, had to go by the same rule books as New York and Massachusetts. I mean, it's just so interesting to think about what that would be like because it's such different demographics. There's states that are much more rural. There's states that are much more populated. Well, you got to think about that. What are all these states needing that may be different than another? So that's kind of what these states are doing when they work on waivers. So now we're going to get into the 3 main waiver types. These are not the only waivers, but this is something that most states would have. So I just want to provide that for you guys to give more of a broader understanding. And maybe in future episodes, we can dive a little bit deeper into each state and what waivers they have. So the 3 most common that you will hear about is Section 1915B, Section 1915C, and Section 1115. These numbers refer to sections of the Federal Social Security Act. You do not need to memorize the numbers. Don't think about it that way. What matters is understanding what each one generally does. So let's dive into it. And let's start with 1915B. The 1915B waiver is often used to change how Medicaid services are organized and delivered. These waivers are commonly connected to Medicaid managed care. Here is a simple explanation for managed care because we haven't talked about that. Under traditional payment systems, sometimes called fee-for-service, the state Medicaid program pays an enrolled healthcare provider for each covered service the provider delivers. So under managed care, the state contracts with a health plan or managed care organization. You may hear about Medicaid managed care organizations called MCO. That's just a little abbreviation for them. The health plan is responsible for arranging or managing covered care for its members. So under 1915B waiver, it allows a state to require Medicaid members to receive services through certain health plan or provider network. It may also allow a state to operate a program in only parts of the state or to contract the selected programs. For example, imagine that Medicaid normally allows a person to visit any qualified Medicaid provider. Under an approved 1915B waiver, the person may instead have to select a provider who participates in the network of the person's Medicaid health plan. This is similar to how private insurance plans have in-network and out-of-network providers. So think of it as like your health insurance, right? Like if you have health insurance, it's typically you see in-network doctors and out-of-network doctors. 1915B is creating that within the Medicaid system. So a 1915B waiver may allow the state to set aside federal requirements involving a person's freedom to choose among all qualified Medicaid providers, providing the same program throughout the entire state, or providing exactly the same service arrangement to every comparable Medicaid group. Federal Medicaid guidelines identify 4 forms of 1915B authority. These include managed care networks, enrollment brokers, using certain things for additional services, and selected provider contracting. You do not need to remember all 4 of those. Believe me, if you cannot tell, I have to jump back to my notes a lot for this because there's just so much information, and I want to make sure you guys get the best of it. So just think about it in the easiest way possible. 1915B is usually about how Medicaid care is managed, organized, and delivered. So it can be available to some people in certain parts of the state. It could be different in certain parts of the state depending on how rural it is, what the demographic is. Kind of leaves it up to the state to be able to change certain things to better benefit certain areas. That's just the way I think about it. Yeah, so that was a lot of information about 1915B, but I do want to move on to 1915C. So let's go there. This is a type many families are referring to when they say that their loved one is on a waiver. So I would say if you're hearing from somebody, obviously get clarification first, but I would immediately kind of assume they might be on 1915. So 1915C, waivers allow a state to provide approved long-term services and supports in a person's home or community instead of requiring that person to receive care in an institution. We talk about home care majority of the time. We also talk about in-home hospice care, but this is the waiver that we need to talk about. This is what's allowing individuals to come into your home, serve you, give you the opportunity to be comfortable while also receiving the care you desperately need for most people. And you don't have to go to an institution. We talk about this all the time. I'm not going to preach to the choir, but I want to make sure that you get that for 1915C. These are commonly called home and community-based services waivers. You may see the letter HCBS. HCBS, as we all know, simply means home and community-based services. So if you hear me say that, I want to make sure that you know that that's what I'm talking about. So these services under 1915C provide in place such as a person's home, in a family member's home, a supportive living arrangement, at a workplace, a day program, or another community setting, possibly even a school. The goal is to give eligible people an opportunity to live and receive support in the community rather than in a nursing facility, hospital, or other institutional setting, while also saving the state money. So that's why a lot of these states, are bringing this waiver in because it helps them save money while also providing the care to individuals that need it so desperately. It's kind of a win-win situation, if you ask me. So CMS describes home and community-based services as opportunities for Medicaid beneficiaries to receive services in their home or communities instead of institutions. Again, preaching to the choir. We talk about this all the time. 1915C waivers may serve these individuals. So we're talking older adults, children or adults with physical disabilities, people with intellectual or developmental disabilities, people with TBIs, traumatic brain injuries, children with complex medical needs, or another population identified by that specific state. Again, I want to reiterate, as I do, I feel like every time we talk about anything specific like this, every state is different. That list is going to change for every single state. Typically, you're going to see those first 3, but it's different all the way around, and they name things differently. So please just understand this is a general overview, and I just want to clarify that. So they may include these type of things that are being served to that individual under the waiver. So we're talking personal care services, respite care, nursing services, case management, supported employment, day services, assistive technologies, home modifications, transportation, habilitation, and other certain therapies, again, different by state. The 1915C waiver does not automatically cover every service that could be provided in a hospital or an institution. The state must identify the services included in its waiver specifically. CMS must have been approved those, and each participant receives services based on the individualized plan. CMS allows states to tailor 1915C programs to particular target populations and to establish additional eligibility criteria within those populations. So this could fit anything. They can mix it and mold it as long as it's okay with CMS. It can help support a very in-need population that might not be able to find the services they need under general Medicaid. So if we're thinking about to qualify for the 1915C waiver, a person generally must meet what is called an institutional level of care. So without this waiver or without home care's existence, they would have to go into an institution. That's pretty much what it's saying. So 1915C helps eligible people receive long-term services and supports at home in their community rather than in an institution. I feel like that's the easiest one to remember just because we talk about long-term services and supports and home care so often. So I hope that's easy for you guys to remember. And we'll keep on trucking. So let's get into if a state uses both. So if a state uses both 1915B and 1915C authorities as part of their same larger Medicaid system, the 1915C determines who qualifies for home and community-based services and which services are available. The 1915B determines which health plan manages those services, which provider network must be used, or how care is coordinated. So I want to give like a simple example of this. Imagine that a person qualifies for an intellectual or developmental disability waiver. The 1915C authority may allow the person to receive respite, supportive employment, and help with daily activities in the community, while the 1915B authority may require those services to be coordinated through a particular Medicaid health plan. So that can all come together. Those two can fit together in the same state. And again, each state looks different on how they do this. So that is why Medicaid programs may mention both numbers when you're looking at your specific states. All right. Last one out of 3. I know I'm just filling your heads with information today, but I promise it's all great and it's good to know when you get into these conversations. So the third major authority is Section 1115. 1115 allows states to test broader or more experimental approaches to Medicaid. These are called demonstrations because the state is demonstrating or testing whether a new policy works. CMS may approve Section 1115 projects that are expected to promote the objectives of Medicaid. And 1115 may test changes involving who qualifies for Medicaid, which benefit Medicaid covers, how much someone pays towards care, how healthcare providers are paid, how physical and behavioral health care are coordinated, how people leaving correctional facilities are connected to care, or how Medicaid addresses other needs that affect a person's health. So all that, this is a really broad waiver. It's just, this is how states kind of fiddle around and see what's going to work. Let's try something new, moving up with the times. Obviously, a lot has changed since years and years ago when Medicaid first started. So it's just very interesting. This waiver kind of gives states the opportunity to test new things. So for an example, a state may use 1115 to test a new program for people with substance or use or disorders, or to provide limited support for certain health-related housing or nutrition needs. So approval on a state's 1115 program does not mean every other state automatically receives the same authority. 1115 are generally time-limited, monitored, and evaluated very heavily, especially in the conversations we're having today about what's going on in Medicaid. Everyone's kind of got their magnifying glass on every single detail. That is what's always been happening with 1115. That it's under a microphone, under a magnifying glass, and just really seeing, is this new idea working or should we just stop trying? So they are also generally expected to be budget neutral to the federal government. Budget neutral means the federal government expects Medicaid spending under the demonstration not to exceed what is likely would have been spent without it. So if it's costing more money, we don't like that. That's a no-no. But if it's saving money or kind of staying at the same level, but maybe providing others some more opportunities or helping it become a better process, that's a good thing. So I want to provide you with just a little news clipping about what is going on with 1115 right now. You may have heard about it in the news. If you work in this space, you may have heard about this as well. Recently, CMS guidelines to state Medicaid indicate that CMS will no longer approve new 1115 waivers on or after January 1st of 2027. And its intent not to reauthorize existing 1115 waivers upon their expiration. This advanced notice gives states the time needed to transition services to a 1915C waiver as their 1115 waivers near expiration. The easiest way to remember this, it allows states to test broader Medicaid ideas, but from that recent announcement from CMS, they're kind of phasing this out. This is 1115 isn't going to be as big of a thing as it is now, and they're expecting states to take their current 1115 waivers that are approved, that are working, that are making things happen, and transfer them over to a 1915C, or they may become non-existent. So just a little update there. I wanted to make sure you knew what an 1115 was because it is more of a common one currently, but over the next 5 years, that's going to be something that we hear about less and less. So let me give you just a quick memory tool. I love memory tools, especially working in this industry. There's a lot of acronyms, there's a lot of numbers, there's a lot of things. So we've got to have memory tools to make us understand. So when we're in conversations, whether that be with an employer or with someone that's receiving services or even with a legislator, we can remember these memory tools so we can deliver the best explanation to them who may also not know. So let's go back. 1915B, how care is managed. Remember that. B is how it's managed. C, 1915C, is how eligible people receive long-term support at home or in the community. So think about 1915B is being managed. 1915C is about the care recipient and them being able to stay at home. And finally, 1115, for the time being, remember, it's how states test larger Medicaid changes or new ideas. I just like thinking new ideas. That's easy. That's quick. It's about remembering those new ideas and how Medicaid can implement them. So that was a lot of information. I know it's okay if you want to pause this, take a beat. But we're going to dive a little bit deeper. I want to make sure that you have everything that you need to know about waivers. So Medicaid waivers, as we've said, can serve many different populations. It can serve a child, it can serve an adult, it can serve someone with a TBI, it can serve somebody with physical disabilities. We've talked about this, a running list that it can serve. A state may operate several different 1915C waivers with each one serving a different population. So like a state doesn't just have one 1915C waiver that serves a ton of different people. It can have multiple that serve separate populations. So I want to go back and make sure you guys know that. So if you're talking to somebody that says, oh, I'm on a 1915C, you can say, clarify, oh, which one? And different states have different names for theirs. Yeah. So to give just a little bit of an example of that from my own state, North Carolina, for example, has a program called the Innovations Waiver. Florida has a program called the iBudget Waiver. The names, as I said, are very different from each state. If you ever have any questions about what waivers are in your state specifically, feel free to reach out to us at advocacy@heartsforhomecare.com or comment under this video. I'd love to talk more about it, and I hope to eventually get into this a little bit more state specific, but just give you examples that each state has different 1915C waivers and have different names. So you may have heard myself talk about this or somebody in your circle talk about wait lists. What is a wait list and why do they exist? So now we come to this section, and wait lists kind of surround a lot of our advocacy topics when we are going into the General Assemblies, legislative buildings, talking to legislators. These are the people that aren't receiving the care yet. They're waiting. So why there's a wait list. So a family may be told that their loved one appears to meet the requirements for a waiver, but still cannot begin receiving services. So many of the 1915C waiver programs are approved, but they have limited spots. So think about it. If you're going to a concert, I remember back in the day, everybody wanted to go to a Taylor Swift concert, and there's only so many seats in the stadium, and there was so many of us who wanted to go to that concert. There was a wait list for it. I will take it personally that I never got in, but just an example, that is kind of how this is working for waivers. States may limit the number of people served because of the amount of state funding available, the number of federally approved waiver slots, the number of qualified providers, or the state's ability to oversee the program safely. So it kind of just keeps things flowing. If you let everybody into that concert, no questions asked, we don't care that there's not enough seats for everybody, it'd be chaos, right? You wouldn't be able to keep track of everybody. The staff wouldn't be able to keep up with security. That's how I think of these wait lists and how states kind of ensure the safety of everyone. So others may give priority based on urgency, health and safety risks, a caregiver circumstance, or the likelihood that someone will otherwise need institutional care. An important point for families is that the phrasing wait list does not always mean the same thing. In one state, a person may receive a full eligibility assessment before being added to the list. In another, someone may join an interest list before the state determines whether the person meets every requirement. So another example, every state is very different on how they kind of handle their wait lists. So what should a family ask when they're going into this? So I have a list of things that they should ask if you're listening and you're a family and you want to learn more. So ask, has my loved one been fully determined eligible? So have they been fully determined that they would actually be allowed to receive the waiver? Is this waiting list or is it an interest registry? Important clarification. How are people prioritized for this certain waiver? How will the state contact us when there is a slot open or any updates about being on the list? Do we have to update our information at all throughout the process? Is there an emergency or urgent need process? Are any other services available while we wait? That's a big thing. Some people are on the wait list for a very long time. We don't like to hear that. It's not a positive thing to talk about, but you need to be asking, what can I do in the meantime? And it can place an enormous pressure on the families. A parent may provide care around the clock without any help at all or enough help. An older adult may struggle to remain safely at home. A younger adult may leave school without access to employment or community supports. And even when a person receives a waiver slot, there must still be a qualified worker available to provide the service. So even if you get a slot, there can still be some delay, which is never something we like to hear. This is why reducing wait lists requires both funding for more people to receive services and investment in the workers who actually provide the care. We talk about all the time. Invest in our workforce. We have workforce crises happen in almost every state. It's a struggle that we face all the time, especially in advocacy. And these are the 2 points that we talk about. So if you're joining this podcast and you're an advocate or you want to be an advocate or you're hearing all about waivers right now and you're just feeling fired up and you want to go talk about this to help support those in need, remember these 2 points. Funding for more people to receive that service, opening slots, and investment in the workforce that provides that care. I'll get off my soapbox now, but I think that is the most important thing to remember. So we're going to play a little game. I know this is a really long podcast, but I think the more games we play and the more knowledge that we gain, the better we can do when we have these conversations out in the world. So let's play myth versus fact. Myth 1. If I qualify for a waiver, I will automatically begin receiving services. That is false. A person may meet the program's requirements, but still have to wait for funded openings. Just what we talked about with the wait list. Myth 2. Every Medicaid waiver provides home care. That is not true. The 1915C waiver usually focuses on home and community-based services, long-term supports. 1915B waiver may primarily change how Medicaid care is managed. Remember, managed for 1915B. And 1115 just demonstrates how it can try different policies in different states. So when we're talking about home care, we're talking about 1915C. I want you guys to remember that. Myth 3, every state has the same waiver. No, every state does not have the same waiver. They all have different program names, eligibility rules, services, wait lists, and application processes. It can all vary by state. So remember, if you want to know more about your state-specific waivers, please reach out to us. We would be happy to help you. So myth 4, waivers are only for children. That is not true. Some serve children specifically, some serve adults, some serve older adults, and some have a very wide range that serve all ages. Now, it's different. Again, different every state. But no, they do not all specifically go to children. Myth 5. A diagnosis automatically qualifies someone for a waiver. No. The state may also consider the person's daily support needs, medical needs, ability to perform everyday activities, financial eligibility, age, and whether the person meets the required level of care. Myth 6. A waiver is a separate type of health insurance. No, it is an authority used within Medicaid. A person receiving a waiver service may also have a Medicaid health plan, Medicare, private health insurance, or another form of coverage. It does not serve as its own health insurance. Big thing to remember. That could be a big confusion. Myth 7. Home care is always cheaper than institutional care. Fact. Home and community-based care can often be more cost-effective, but every person's situation is different. The value of home care is not only financial. It keeps people living with their families, attending school, work, participating in their community, maintaining relationships, and a greater choice of independence. So just a big thing to remember, we aren't always talking about the cash. It's not always about the dough. It's more about quality of life, how these patients are receiving care. Is it working for them? Is it better than being in a hospital or in a nursing home? And obviously that may be more expensive too. So it's just important to look at all that. Myth 8. Once someone receives a waiver, they will keep it forever. Not true at all. The state may review whether the person continues to meet medical or functional requirements, financial requirements, the required level of care, and other programs. So it's just a renewal paperwork, typically, that it's keeping things under a magnifying glass. They want to make sure that that slot is being used correctly and it doesn't need to go to somebody else that is in need of more care. Myth 9. Being on a wait list means the state has completed every part of my application. Not necessarily. Some states use interest lists that people can join before fully financial and clinic review is completed. So there's a difference between a wait list and an interest list. You need to make sure you know which one you're on. Or if you're talking to somebody, ask them which one they're on. If they don't know, tell them to verify, because they're very much two separate things. So how do families even determine which waiver that they need? Because there's so many different types and every state is different. If you're a family out there that's questioning, well, is this something that I need? I'm going to give you a little overview, but I would absolutely recommend contacting somebody, contacting us. We can get you in touch with people that can support you to make sure that you're going in the right direction. So the right program depends on where the person lives, the person's age, the type of disability or health condition, the support the person needs, the required level of care, and financial eligibility. A good first step is to describe the person's needs in everyday language. For example, my child needs nursing care throughout the day and help with daily activities. Or, my adult family member has an intellectual disability and needs help with employment, transportation, and participation in the community. Or, my older parent needs help bathing, preparing meals, and remaining safely at home. All many different type of things that can help lead you to what type of waiver that you need. So if you're looking to contact somebody, of course, I've said please contact us if you have questions. We're happy to help. But you can also contact your state Medicaid agency, a local aging and disability resource center, a developmental disability agency, the Medicaid health plan, hospital social worker, doctor's care coordinator, school transition coordinator, or a trusted advocacy organization like us, Hearts for Home Care. So definitely, what are you going to ask once you get there? I think that's the biggest thing. Like when I go to the doctor, I wonder what should I ask my doctor about everything that I need to know. So here's a few things you should ask them. What programs serve the population? What services does each program cover? What financial requirements apply? Is there a waiting list for this specific waiver? How are urgent cases handled? What documentation is needed? And are there other programs available while we wait? Again, some major questions that you need to keep up with. You should keep records of all the phone calls that you have, even the ones you call and ask questions to, the names of the agencies you've contacted, the person you spoke with, applications for reference numbers, copy of medical records. You need to keep all those important documents, and you need to make sure you remember who you've already spoke to, because that way, if you keep a record, it can help them if they didn't keep a record. I mean, I think we all face that day to day, even calling about our cell phones when the Wi-Fi stops working. We need to keep track of who we talked to and what happened so we don't have it happen again, right? So, if the state sends a letter to an old address or call the disconnected phone number, a family can miss an important deadline and opportunity. Like I was saying, please, if you are trying to figure this out, it is so common that this can happen, and then you lose your opportunity to receive care. It shouldn't be that difficult, but as we all know, things just sometimes aren't that easy. So just please make sure when you're going through this process to have all your information ready to go at a moment's notice. So, with all that being said, the goal is to identify the right agency, to ask clear questions, keep good records, and continuing following up on things. Even if you're on the wait list and you just talk to them, it's okay to call and follow up about what's going on. All right, so that was so much information. My head is boggled by all the things we covered today, but I'm really excited about this podcast just because this information is so important. There are so many times that I meet friends and family or people out in my community who have no idea that any of this exists or have no idea how to find it or how to get their, family member or themselves the support they need. So I really hope that this helps someone out there, or maybe it just helped you learn more about it in case you ever find yourself in this circumstance one day. I want you to remember the key takeaway. Medicaid waiver is not one specific benefit, insurance plan, or home care program. It is a legal tool that allows a state to operate part of Medicaid differently from certain standard federal requirements. That is the biggest thing. For families, these programs can mean the difference between receiving care in an institution or being able to remain at home, surrounded by family and connected with community. Nothing more important than that. All right. With all that being said, I'm so excited to catch up with you guys next time. I will be back in August with another podcast. But in the meantime, please comment questions. Leave comments about your experiences. Anything you want to share with us. It is just so important to hear from all of you guys on ways not only that we can provide you guys with more information, but also just to hear your experiences. And if you'd like to share your story, you've had experiences on a wait list before or with a state waiver, we would love to have you share your story. Go to Hearts for Home Care website online, heartsforhomecare.com, where you can share your story in a short 30-second video and tell us all about it. And we'd love to support your advocacy journey. Thank you so much, guys, and have a wonderful summer.